Thank you. So welcome everyone to our webinar for the Mentally Healthier Councils Network on adult social care and mental health. I'm Shizana, I'm the network lead, and I'll be hosting today's event. So before I introduce you to our speakers, I just want to share a quick update on what we've been doing at the network and share our brand new resource, which I'm really excited about, which we launched yesterday. So firstly, back in May, during the local elections, we updated our manifesto asks, which outlines what councils can be doing to support your communities. Kadra, can you share the link in the chat, please, if that's okay? As people are coming in, I know you've got a few things. Thank you. So we've included a link in the chat, so please do have a look. It sets out actions into 4 key areas: reducing poverty, improving the environment, supporting the best start in life, and providing better access to quality services. Secondly, we're really pleased and really excited to be launching our brand new webpage resource highlighting all the brilliant work that you're doing to improve the mental health of your communities. So thanks to everyone who's sent in details of your policies, your initiatives, the schemes. We sent out a survey last year and you sent us responses in that. So thank you. Here's a little bit of an illustration. Kadra, are you able to share the screen, please, with the web page? Just give you a minute. So here's an illustration of how the web page looks. Thank you. And how to navigate it by clicking on the drop-down links to highlight the council's work. And if you click, once you start clicking on each link, all the different topics come up. We have some brilliant work already online covering topics such as children and young people, environment and green spaces, housing and physical health. And then when you go into each section, if you click on read more, it goes to the actual webpage of the council or the initiative or wherever the news item is. So this is a live page, so please do feel free to keep sending me details and we'll continue to add these and build up the resource page as we go along as well. And last but not least, this summer we'll be piloting our benchmarking scheme with the aim to launch this in the autumn. So thank you again to everyone who responded to our survey, asking you what your priority areas are. Based on this, we've produced a set of criteria that will benchmark the good practice you are doing in being a mentally healthier council. So that's enough from me. I think we might have a bit of a move around in our agenda. I'm not sure if Robert's
I think
able.
Robert's just arrived.
Oh,
Yeah.
lovely. So it'll take me a second just to welcome everybody anyway. So welcome Robert Lewis from Department of Health and Social Care and Denise Monks and Liz Howard from the British Association of Social Workers, who are going to give us an update on their current focus and insights on mental health social work. Plus, we'll be hearing a little bit about the Independent Commission into adult social care from them as well. We're also joined by Andy Bell, our wonderful CEO at Centre for Mental Health, who will share some reflections to close the presentations as well. So, Robert, if you're in the room and if you're ready, can I hand the mic over to you?
I can try. Can you hear me okay?
Lovely. Yes,
Yeah,
yes. Yeah.
sorry. Yeah, behind this smooth exterior is a duck's feet going like this because I haven't been able to get online. I haven't been able to open this Zoom. So apologies, just this literally come on this second.
Oh, thanks for joining us and
No worries, no
agreeing to
worries at
join
all.
us. Sorry about that.
No, that's fine. I'm hoping that you can see my slides. Let me know if you can or when you can. Is that okay? Yeah, cool.
Yeah.
Sorry, I'm on another computer as well, so the mouse and nothing's working. Hello. So yes, Robert Lewis. I'm the mental health social work lead, as it says here at the Department of Health and Social Care, and I work in the Office of Chief Social Worker. So currently working with Sarah McClinton, and this is a seconded role. So I'm a social worker, I'm an approved mental health professional, and I'm kind of in this role, hopefully for a kind of another year or so. And I will just share very briefly with people in case you haven't sort of seen this before or know what this role is about. Effectively, what I do is try to offer a kind of subject matter expertise, I suppose is what they call it here. So where we have things like the bill, mental health bill, progressing through Parliament. I'll work with the bill team and others on kind of looking at the impacts of potential amendments, looking at impacts on practice and other issues like that. So since being in post, Mental Health Act reform has kind of formed a really big part of what I do. What I'm just sharing with you there is very broad, but that is basically the job description. So I kind of dip my toe in or have something to do with lots of those different areas around social work practice, social care, but from a mental health perspective primarily. And so, yeah, so it means I can get involved in lots of different things. And what I'm effectively trying to do, I guess, is represent the profession, to sort of promote voices here. So I do an awful lot of work linking in with different networks, going around the country, seeing colleagues, and trying to pick that intelligence up and that experience and bring it into the department and kind of other government bodies as well. So yeah, so that's kind of me, and that's what I do. So it's very privileged sort of position to be in, and at some point I'm going to have to go back to doing the day job, but at the moment I'm doing this. I just thought it might be helpful just to kind of put a bit of context around in terms of numbers of what we're talking about when we talk about mental health social work. So for us, these are the kind of statistics around that in terms of workforce. So if we think that from a regulated profession point of view, we've got just over 100,000 social workers in the country. And as you can see from that figure in the top left, in terms of nearly 1 in 10 of those would identify themselves as working in mental health services. So yeah, just over 9,000 there. And these two other figures on the top line are kind of to be confirmed, but we're looking at, from the best estimates that we have, around 3,700 whole-time equivalents. So obviously that will be more colleagues than 3,700, but as a full-time equivalency across trusts in the country, that's how many that we're talking about. And then we have in local authorities around 1,500 who have that mental health kind of job description or working in mental health teams. Again, that's a whole-time equivalency. So I don't actually have the figures of headcount. But what we would know, of course, is that the rest would sit in the VCSE sector, the independent sector, and in education, amongst other things. And I've added in as well there the numbers around approved mental health professionals. Now, while approved mental health professionals aren't exclusively social workers, as it says there, 93% of them are. So a lot of the work that I do is also kind of having a responsibility around kind of strategy and policy and supporting AMPs in practice as well. So we have, as a headcount, we do know we have about 3,800, but as a full-time equivalency, that is only 1,600, covering 7 days a week, 365 days a year. So it's quite a small group, quite a fragile group in many respects, and part of some of the work that I'm looking at. Some of this will be very familiar to people, I'm sure, but it's just kind of worth reiterating in terms of there's an awful lot going on at the moment. I've come into this department at a time where we've got a government in its first year or just through its first year. We've seen already some fairly sort of seismic kind of moves and changes and things happening for us in this part of our world. And for those of you kind of, well, most of you I'm sure will be aware that this government describes itself as a mission-led government, and NHS Fit for the Future is one of those missions. And people may be familiar or increasingly familiar with that language around analog to digital, these three shifts: analog to digital, hospitals to community, treatment to prevention. And I think from a social work, social care, and sort of social model perspective, then certainly the latter two of those are things that we are very familiar to us. These are the things that we do kind of routinely. And so in that sense, these kind of shifts are things that hopefully as a profession we would be very supportive of and trying to get behind. We've just had the 10-year plan come through, and I've just put a couple of headlines under that in terms of what we've seen being flagged in the 10-year plan, the NHS plan. As I said, I think it came out last week before. There's definitely a very big focus on younger people, children in schools in terms of their mental health and support around that, very much into that sort of preventative idea. We've also seen flagged that idea around mental health emergency departments, of which we need to see a little bit more of that detail. There was a manifesto commitment for from Labour for 8,500 new mental health staff, so we need to keep a track and work out who that is, where are they coming into on stream. There was also a focus in the 10-year plan on a kind of a refocus on that assertive outreach concept. Many of us will obviously be very aware of the tragedies and the killings in Nottinghamshire, and kind of as a part of a response to that is ensuring that some of our most hardest to reach, hardest to support from a service point of view, that clientele, that those people who draw on our services, sort of an increased focus there on our services being more assertive effectively. And again, another big push is around the use of artificial intelligence and IT, trying to support workers, free them up to do more of that kind of qualitative work alongside people, and having better systems, utilizing AI and other things. And then we're also promised some modern service frameworks, which we are expecting to start seeing next year. All very new, so still very much trying to sort of get heads around some of that stuff. As already been talked about, will be talked about later, there is the Independent Commission on Social Care, kind of gets called the Casey Commission. That isn't being run by the department, it is independent, but obviously we're trying to feed into that. And other policy areas, again, fitting this whole kind of move towards sort of prevention, more neighbourhood type work. What we are seeing coming out is we've currently got the 24/7 pilots. We've got 6 of those around the country, the neighbourhood mental health centres. Very much, from my perspective, a social model of mental health intervention. And also, you know, we've got in that broader NHS offer is a move towards neighbourhood services, and yeah, kind of being closer to community, reflecting their communities and being much more sited on the populations in place, rather than kind of clinic hospital based. And also, as I did say, there's a lot going on. We have the personalised care framework consultation, which is happening at the moment through NHS England. I'm not allowed to say it's a replacement for CPA, but it's in that ballpark. So when we're thinking about the community mental health transformation, and big questions, and I think some of our colleagues tripping up a bit around what's happened to CPA, how does that fit within that? So the personalised care framework kind of fits into that space. And a small matter of mental health act reform. So huge amounts of work going on. I've put in there, I don't know whether this is top secret or not, but we're expecting Royal Sent sort of last quarter of the year. We were working to timetables that were hopefully going to get us before summer recess, but we're not there yet. Lots of work being done on that. So that's the kind of overview as I can see it from a mental health perspective. Using a similar slide, but just to kind of think about our priorities and challenges here. So working in this space for me is kind of really interesting. It's frustrating. It can be exciting. You know, it's pretty much every emotion that you can imagine. Trying to have influence, trying to get social work voice, social care voice into the mix here. So some of the priorities and challenges I've kind of listed have a very similar theme really, which is about ensuring that the social work, social care voice is central to these changes. We have NHS England coming into the department, so that's a huge reorganisation, as people will be aware. And so the challenge for myself and for Sarah in the Office of Chief Social Worker is to try and make sure that social work, social care is represented within that. Similarly, the 10-year plan, neighbourhood services model, you know, not just in mental health, but more broadly as well. We really need to make sure that we're kind of getting involved in those planning, system designs, evaluation, kind of spaces, making sure that we kind of show the value of what we can bring to the work. And similarly, into the independent commission, and I know that colleagues will be talking about that, so I won't go into that anymore, but yeah, that's part of what we're trying to do as well. I think more specifically around some of the things that I'm involved in and what I'm finding increasingly on my travels is a sense from colleagues working as mental health social workers that there's a sort of sense that there isn't a shared identity. And I think in some respects, that's really symptomatic of the fact that we are located, as I sort of showed earlier, that some of us are in trusts, some are in local authorities, some are in the independent sector, some are in the VCSE sector. So we're all doing many different things, and some of us are in social work posts that have social worker in the title, but many of us are in kind of more generic roles or in leadership and management roles. And so kind of a question for myself and for other colleagues, you know, including colleagues at kind of Social Work England, BASW, all of those is kind of how do we ensure or kind of galvanize what we know we share and have in common, which is often a values-based practice, a person-centered approach, and, you know, and pulling into and leaning on lots of other concepts that will be very familiar to us. How do we kind of galvanize that so that there is a sense of collective here? And so that's quite a challenge, as I say, because of all of the kind of disparate places that we work in, but it's certainly something that we're looking at and thinking about. And included in that would how do social workers, new social workers, come in through the system? How do we ensure that we've got routes for them to gain that mental health experience as, you know, as student social workers and so on? And the final bit, again, for me, because of my role, very specifically, it's about the implementation of the bill and the development of the new code of practice, which will be consulted on. And for colleagues here who you know, who maybe work as approved mental health professionals or very interested in the legislative reform, you know, the messages coming out are fairly clear that we will, that the code will follow, the code of practice will follow Royal Assent, the work on it. So the work on that will take place. We will be linking in right across the sector in the development of that, but also there will be consultation around that. And the code would need to be published and trained on before the main parts of the bill were switched on or the updated act were switched on. So there's a lot of work ahead in the next year to make sure that we get and ensure that the voices of people who are actually doing the job and the experience is being matched in that code of practice to make sure that we are absolutely answering the questions that we need to. And I've put the little teaser at the bottom, LPS, Liberty Protection Safeguards, what happens next? You know, I've noticed that BASW and ADAS have written to Minister Kinnock, following some of his comments there. So there's certainly a focus that where we're going to have a look at that as well. I'm not very good at keeping time, basically, as I've all my normal things. How long have I got left? Because I don't want to overrun for colleagues. Somebody able to say?
We've overrun a tiny bit, but it's fine. You can have a couple of minutes more.
Okay. Well, I think if it's okay, I'll leave it there then, because I think we've got questions and stuff at the end. So there's other bits and pieces I could raise, but given the timings and stuff, I'll kind of leave it at that point.
If we have time, we can always come back to them.
Yeah.
If that's okay.
Thank you.
Oh, thank you so much for giving us that overview and for persevering with joining us as well. Thanks. Denise and Liz, can I hand over to you guys?
Great, thanks.
Have we lost Liz? Denise? I know you're there. You're on mute.
Sorry about that. It's really difficult when you're trying to share and then I lost my own screen.
Yeah.
Just let me get to the. Okay, if somebody can let me know. Are we up on the first slide?
Yes.
Yeah,
That's fine. That's
fantastic.
perfect. Thanks, Denise.
Thank you so much, Shazana, for inviting us today. Really great to be here. And I know we've got a really mixed audience actually this afternoon. So we do potentially have 1 or 2 social workers in the audience. So I'm aiming this presentation predominantly at people who aren't social workers, because I believe that's the main audience. So if I'm saying things that are a bit simplistic, then apologies. So my name's Denise Monks, social worker and professional officer with the British Association of Social Workers. My background predominantly adult social work, I've been qualified for 24 years, but I have worked as mental health commissioner and in children's services previously as well. What do we know about the British Association of Social Workers? Well, we've got over 22,000 members. Because we're a member-led organisation, we do have a membership fee. We do rely very heavily on that and other activities such as training, etc., that we deliver. But the beauty of being a member-led organisation, we're independent. We don't rely on government subsidised funding, etc., which gives us the probably privilege of being in a position at times where we can challenge or we can offer differing views to maybe those that might be out there as general policy, and that's because we are completely independent. In terms of how kind of some people, there's a misconception that BASW, sorry, I'm just going to go back a second. Oops. There is a bit of a misconception that BASW is a union. So just to clarify, we are a professional organisation, but there is a separate union for social workers, the Social Workers Union, and whilst we're affiliated with them, we're 2 separate organisations. So just to make that clear to people, because that is sometimes a bit of a stumbling block for people understanding where we're coming from on things. So just thinking through the landscape in England, Robert, you stole my thunder. So some of the statistics I'm going to run through, but I'm going to do this really quickly because we have covered a lot of it. The figures that I'm looking at the moment, we're saying 2022 because that was the last time that the benchmarking exercise, I believe, was done for mental health social workers specifically. And at that time, there were 97,000 registered social workers in England. That number is now up to 102, over 102. Of that, in 2022, 3,576 were directly employed in mental health services, employed by the NHS. However, if you put that in the context of the overall population of social workers, in 2022 we had 48,000 social workers employed directly in local authorities, children's and adult services. And the reason I always include that particular statistic is because I think people always think of the role of social workers in terms of local authority statutory work. And actually, there is a lot more going on out there in terms of connections with our communities, roles that are undertaken in VCSC sector, roles outside of mental health that are undertaken in the NHS, and that's not always very visible. Roles, for example, hospital discharge, etc. So that's quite a number there. We've got 44,940 back in 2022 that weren't employed in local authorities or employed in NHS mental health trusts, which is quite a large number. In terms of what kind of is happening at the moment across mental health services, a lot of the discussion here, and probably happens generally, will focus on specialist services. It focuses on things like your NHS community teams for those areas where they've dissolved their Section 75 partnerships, whereby they would have maybe had social workers based within NHS teams, but still employed by the local authority. We've seen a lot of those arrangements dissolve, and the result being that you've now got specialist mental health teams within local authorities. So quite fragmented in some areas. But whilst we're speaking to that, there are also a number of teams out there, a number of services, particularly say mental health service, local authority services, where mental health is everybody's business. It's happening day in, day out within these other teams. So for instance, your generic adult teams in a lot of local authorities will be working with people who are experiencing mental ill health, but perhaps they don't meet the criteria for the specialist teams. And so there's a bit of a challenge there in terms of the knowledge held within those teams, the expertise and the training that's actually offered in those teams to those individuals. Equally, we also now know our children and family social workers are working with parents who may be experiencing mental ill health. They may be working with children and young people who are experiencing mental ill health. So it's not something that solely, and you know, we know that, but it's just to really spotlight that actually it sits across lots of different areas. Some of the challenges that kind of have been experienced at the moment within social work across various different areas again are, as I've described there, the dissolution of the Section 75 partnerships. There's currently we're hearing, and it's not the same everywhere, but we are hearing of recruitment freezes within the NHS, which is impacting on posts, currently vacant posts being recruited to. We know that there's a greater emphasis on community-based and preventative services, which we really welcome. But actually, it's where the money follows. Is the money actually making its way into those services? And if it isn't, what's the impact if actually we see the tap turning off in terms of acute or inpatient models, but we don't see, you know, considerable investment in that community-based provision? We've also, we're well aware, and I'm sure there's been discussions in this forum around the alternatives to inpatient mental health provision. So looking particularly at maybe, for example, the models that are being explored around children and young people's mental health services, where models of accessing perhaps a day service local to their community, and then the inpatient element is just for the overnight stay. So actually people are leaving the hospital site during the day to access something that's closer to home and still embedded in the community. They're models that have been trialled before, but I think there's a re-emphasis on looking at some of that. Again, changing landscape, right care, right person. There probably isn't anybody in the room who hasn't heard of this, but that's a significant kind of change in terms of how services are responding, and particularly the police, in terms of somebody who might be experiencing a crisis in their mental health. And we know that whilst it's been running in some areas for you know 12 months plus, in other areas they roll the scheme out later. Well, there's a variety of different views in terms of how that's actually been experienced in communities, been experienced by individuals. We know that there has been situations where unfortunately there have been deaths as a result of how somebody's mental health crisis has been responded to. And we will be meeting with, we've actually got a representative coming to speak to our mental health group next week to talk about right care, right person, and to gather views of our members who are mental health social workers in terms of how that's kind of being experienced right now in services and for local communities. Robert's already touched on it, the mental health bill. I'll say no more on that because I'm going to come to it when we look at some of what BASW was actually doing. So in terms of some of those kind of looking at some of the inequities, BASW is very much, we have a code of ethics. We are very much focused on social justice and ensuring that actually our members and everything that we do is promoting the rights of individuals and particularly those who might be marginalised. We know that the mental health bill isn't necessarily going to deliver in some areas the change that we would have wanted. So for instance, the disparities in terms of community treatment orders and how they disproportionately are used within certain communities. So for instance, and sorry, I can't actually access my notes delivering this on Zoom. I'm used to doing it on Teams, but I can't actually see my notes. But we know that there's a significant disparity. I think that the numbers at the moment are Black men are 7 times more likely to have a CTO than their white peers. And so that in itself is a significant challenge to services. What can we do to change that? What can we do to kind of build in more equitable approaches to people's treatment, etc. We know, and I'll touch on it again further into this in relation to one of our BASW campaigns, but we know that people who are autistic, people who have a learning disability do experience mental health services differently in terms of inpatient treatment and detention under the Mental Health Act. How are we going to do anything about that? Well, there are a number of initiatives out there that are there to support change. We've got the Patient Care Race Equality Framework, which sits with the NHS and is very much focused around commissioning strategies that reflect the needs of local communities, trying to ensure that actually different demographics, the needs of those communities and what's already available in those communities and those services are reflected within those commissioning strategies locally. We've got the Local Government Association Diverse by Design, again focusing around making sure that services reflect local community need, and then we've got the Workforce Race Equality Standard, which again is an attempt to improve the experiences of global majority social staff within the NHS and other areas, and also ensuring that those organisations are supportive. They are ensuring that the system's in place to deal with discrimination when it happens. Yeah, I'm just conscious of time because I also can't see a clock. So let's
You have a minute or so.
A minute or so. Okay, I'm going to really
a few minutes.
Yeah, I'll whiz through these ones then.
Okay.
Yeah. So some of the challenges specific to our members, and these are all anecdotal. It's really difficult trying to collate statistical data to inform some of this. So it's anecdotal information, but what we know across services, social workers who are working within mental health services and other NHS provisions do experience particular difficulties in terms of their identity, how they share what their role is, how they share what particular value is that they're bringing. And we've actually, within a medically dominated environment, it can be difficult to articulate the social models. We know that things are improving, but that's still a challenge to a lot of our members. Other colleagues not quite understanding what the role of a social worker is. Sometimes that can feel like it's broken down into task-based things. Oh, well, a social worker can deal with transport requests, or a social worker can deal. It's not about the wider remit of a social worker in terms of what I've described before, the social justice, ensuring people are aware of their rights, promoting and supporting people to ensure those rights are met, etc. That's slightly more difficult to articulate, and other professions have managed to articulate because maybe of the functions of their roles that can articulate that slightly easier than social work. And because social work is a relationship based profession, again it can be quite nuanced, which makes it very difficult to articulate at times what it is we're good at, what we bring to the table, and share the value that we have within MDTs, multidisciplinary teams. Government policy at the moment is very heavily dominated towards local authority. We see that across children and adults. For instance, within children's services at the moment, the government, the Department for Education, are in the process of rolling out a new model for newly qualified children and family social workers. And it's solely focused at this moment in time on children and family social workers in local authority teams. But actually there's a whole workforce out there in VCSE and other areas that actually this won't help. It won't help our CAMS, our community our child adolescent mental health service colleagues. It doesn't apply to them. So there's challenges there in actually ensuring that as a profession we're seen as a whole and not broken out into local authority and other. For those social workers that are working within the NHS at the moment, we've got a significant challenge, and we at BASW are continuing to advocate and take action and try to spotlight this. And there's a real issue in terms of access to funding and training specific to social work. Other professions such as physios, OTs, etc., are able to access a particular pot of money that enables them to have profession-specific training and CPD opportunities. Social workers can't access that at the moment, so that's a real challenge to us in terms of people keeping skilled up and making sure that they can actually access the training they need for their specific profession. We've got challenges. Robert's already covered some of this in terms of sufficiency and future proofing for the AMP workforce. For those social workers that have moved out of their Section 75 arrangements, we're hearing anecdotally that there's a real sense that when they've moved into local authority specialist mental health teams, they're experiencing difficulties, the flip side of what I've just described with the NHS, some of those teams are actually experiencing difficulties in accessing specialist training as well within the local authority. They're describing very much that they feel they've lost some of that relationship-based practice that they would have had within the NHS, which enabled them to have real close working with individuals. And instead, the focus may be around assessment work, review work, which is not the same as the work that perhaps they were undertaking when they were in the NHS teams. Lack of coordination and lack of contact and sharing of knowledge and skills across other professions if they have moved into one of those more isolated teams. And then quickly, what are we doing about it? So we run regular forums for our mental health social workers. We also have a group which is set up for social workers working in health environments wholesale across all areas. That enables us opportunities to kind of keep up to date and keep members up to date on research and also pull their experiences into that. We also are quite busy at the minute because of the mental health bill, influencing policy, promoting and supporting research through our various thematic groups. But the essence of what we do when we're influencing policy, we rely very heavily on our members. So we're taking direct data experience of social workers and feeding that into our colleagues at Department of Health and Social Care, etc., to ensure that that reality of what's happening for communities, what's happening for the profession is fed into future policy. We've worked really, as I've said, we've worked with colleagues, the Chief Social Worker for Adults, etc., looking at the issue of CPD and training. And we've also been working alongside the Association for Directors of Adult Social Services and the AMP Leeds Network in terms of lobbying for specific amendments around the mental health bill. I'm not going to go into huge detail on that actually. So in terms of some of the wider work that BASW does, I just want to probably spotlight this one for people, the Homes Not Hospitals campaign. Anybody who saw the news on, I think it was Tuesday night, ITV 10 o'clock news, there was significant focus on experiences of adults, young adults who have a learning disability or autistic or both, being detained under the Mental Health Act in inpatient units. This Homes Not Hospitals campaign is focused on that. It's focused on those 2,000 people that were mentioned in the article, and trying to ensure that actually our community services are strong enough, are resilient enough to support an alternative to inpatient treatment. I'm not going to say any more on that because I think I've probably reached my limit on time. And actually, my colleague Liz is actually the lead for that Homes Not Hospitals campaign. So I would defer to Liz if there's any questions on that one. And I think just in terms of, as a final one, in terms of how we know intersectionality impacts on mental health, our communities who are experiencing poverty, they're experiencing racism, they're experiencing the challenges of poor housing, etc. They're all things that we will keep at the forefront of our campaigning activity, and we will continue to mention, you know, the impact on mental health as a result of all those different areas. We also, really quickly, we're very proud of our profession. We're very proud of what we bring to our communities, and we try our best where we can to share that with the rest of the country. Really, we do that through a number of different means. We have a number of we're involved in the Social Work Awards. We're a chief sponsor, but we also have a campaign where we are promoting positive media, not accurate media portrayals of social work. So we're not asking them to say that we're perfect, because we're not by any means, but what we're asking for is appropriate and measured reporting, and to try and shift away from some of the sensationalist style of journalism that we have seen in the past when it's related to social work. So various different initiatives there that we're trying to, in order to shift the narrative and try and make social work a profession that people understand better and actually are less fearful of accessing, and feel that it's something that's there to support them. And I'll share just this presentation, Susanna, when you send it out, has a number of links in there for other resources that I'm happy to send out. So I'm just going to stop sharing and hand over to my colleague Liz.
Thanks, Denise. Just bring my screen up here, which is, there we go. Great. 1 second. Just while I'm waiting for that to load, yeah, again, a huge thank you to Susanna and colleagues here for inviting me along today to talk a bit about developments around the Independent Commission on Adult Social Care. I'll just bring my slides up here so that everybody can see those. Just bear with me. Okay. Hopefully they should be coming on screen now.
Yeah, they're on now.
Great, thanks so much. So yeah, huge thank you for inviting me along. I'm Liz Howard. I'm a social worker by profession and I'm professional officer alongside Denise at the British Association of Social Workers in the England team. I'm really pleased to say this is my 25th year as a social worker this year, so a quarter of a century I've reached, which is fantastic. And my background is predominantly in the world of adult social work, although I have got experience of working in different sectors and also for the social work regulator at a strategic level as well. So my contact details are on the slide in case anybody would like to get in touch after the session today to ask any questions or just to connect really. I'd really welcome you getting in touch if you want to ask anything or something resonates with you. So really this is about what we know so far about the Independent Commission into Adult Social Care. So this is going to be a bit of a whistle-stop tour. I'm also conscious of time and also conscious of the points that Robert and Denise have made already. So just a quick summary here of what we know so far in terms of what's been agreed. So the Prime Minister has asked Baroness Louise Casey to chair an independent commission into adult social care. So that launched in April 2025. To date, we've only had the terms of reference being published, but we do know that the commission is already kind of active in the background, if you like, and that Baroness Casey is really keen to hear from those people that are drawing on care and support, individuals, families, communities, and those working in social care and across the sectors to support social care, to really understand, I suppose, what those experiences are, what those interactions are like, in order to be able to inform the work of the Commission. So it's really about, working with everybody that's connected in the world of adult social work to develop those recommendations, to understand what reforms are needed to the system and to meet the current and future needs of our population. So terms of reference have been published. I've popped a link on the slide there, and I've also popped a link to the actual Casey Commission website as well, in case you haven't seen those. There's not a lot of detail on there at the moment, but that will evolve as the Commission starts to move into the next phase of their work. So we know that that's going to be 2 phases. Apologies, I've just got a pop-up coming on my screen now. Let me get rid of that. Yeah, there's 2 phases, and the first is going to be reporting back there in 2026 with a focus on making adult social care more productive, preventative, and to give people who draw on care and support and their families and carers more power in the system. So that's kind of really the vision and the sort of thought process that we need to keep in mind when we're thinking about how we respond to the Commission. So where are we up to? So in terms of the work at the British Association of Social Workers, I specifically support the adult social work thematic group. And again, as touched on, sometimes that crosses over into mental health and the health arena as well. But really, what's really important to us is to understand from our members' perspective and the profession's perspective what needs to change in terms of the recommendations to the Commission. And much has already been said for over a decade about what's wrong with social care. There's no shortage of ideas when it comes to how to fix things, but really what we're interested in is about how we can utilise the opportunity with the review to really reinforce that valuable and unique contribution of social work in all its many forms, and the difference that we make as social workers to the lives of adults, families and communities each and every day, right across the spectrum of social care. So I thought it would be helpful to share with you some of the ideas that have come through our adult social work group at this point. And again, thinking about those 3 shifts that Robert mentioned earlier around the shift to prevention, from treatment, the shift to analog to technology, and also the shifts around focus from hospital to community as well. So really we've got that kind of idea in our minds, and members have got that idea when they're kind of thinking about where we can best show the difference that we make as social workers. So in the prevention arena, it really is don't forget about social workers. We've got such a huge contribution here to make. And there's lots of activity that's been happening over the last decade and good practice that's evolved. And that's really included social workers from the very start. Our relationship building skills, our ability to motivate and support individuals, families and communities, to recognise strengths and to build on those and to promote independence and quality of life are absolutely key to prevention. And in terms of breaking that cycle of crisis, which we see currently dominating the world of social care at the moment, we've got a key role to play there in freeing up those valuable resources, which can then be reinvested where they're needed. So really that kind of shift to prevention is key. We've got organisational skills that we can bring into the space. We know how to make the best use of community resources, which are really finite and valuable. We know how to foster those connections, to support people before crisis escalates, and to coordinate plans that can meet people's health and social care needs. So we've got lots to contribute here. So it really is, don't forget about us, recognise our value from the very start. Valuing and supporting us throughout is another kind of key theme, really. Again, focusing on that theme around giving more power in the system to individuals, families and carers and communities as well. And that's really what we do as social workers. Denise mentioned before about, you know, the work that we do in terms of championing human rights and making those rights a reality alongside people. And that's really absolutely key here to that social care offer. And Denise mentioned one of our campaign areas around homes, not hospitals, which I'm the lead officer for the association for, which I'm proud and privileged to say is a kind of member-led campaign. And absolutely that campaign is all about the fact that, you know, we've got 2,000 people with learning disabilities and autistic people whose rights are being abused and not being recognised, not being realised. People are being treated less than second-class citizens and are not being afforded the same rights as everybody else to lead an ordinary life and to be able to be supported by social care in the way that people need to live a good quality of life. So our value in kind of acknowledging those issues, challenging them and providing solutions within the system is absolutely key. Our role in professional judgment, you know, kind of being able to offer that at critical points, being that important check and balance in the system. And we really do call on the review, and this is something that we'll be putting forward in all of our contributions to the review, in recognising the valuable contribution that we make through having our skilled social work intervention, our knowledge and our leadership skills to really make those changes within the system that seek to strengthen our role, but also recognise the difference that that can make to people's lives on a daily basis. And key to that is our kind of role, as Denise was saying earlier, around social justice. You know, we're not just there as a kind of gateway to services. Our involvement comes at many points in people's journey, and it's very much about that interface with the social care and health system. And we can really recognise and ensure that the system isn't reinforcing social inequality, that we're there to challenge that. We're there to challenge racism and oppression and discrimination in all its forms and really maintain that focus on rights-based practice, ensuring that people's views and wishes are sought, that they're integral to the support that's being provided, and that they influence, people can have that people power to influence decision making, and the options that are provided are least intrusive of people's rights and freedoms in terms of individuals and families as well. And on that kind of third and final shift around analog to technology, yes, we recognise the fast pace of digitalisation and technologies and how in some circumstances, they can be enablers to social work practice. However, we are very, very clear that they are enablers and that they are not the driver. And they're certainly not a replacement from having a qualified, registered professional social worker involved. You know, we're ideally placed as a profession to look at technology and digital solutions from that ethical and critical perspective. And it's absolutely right that we do. We really need to highlight the possible challenges that may be experienced by this whole scale kind of move to digitisation, particularly by marginalised communities who may be experiencing digital poverty lack of digital literacy and skills in this area, as well as the whole issue around connectivity. So we're really, really clear that we've got that kind of critical stance around digital tech and technology, and that we're highlighting where potentially that might increase inequality or reinforce that. And we are absolutely clear that any solution that comes from digital or AI must never replace relationship-based human interaction and the connections that we bring through social work practice and our involvement. So we're really keen as well to make sure that we capture, I'll just come back in quickly and stop sharing, that we really do capture those positive practice examples of adult social work and where we're making a difference and to be able to articulate that unique contribution that we bring. So we've currently got a call for evidence examples from social workers open. So I'd be really happy to share that link and encourage anyone that is a registered social worker here to contribute to that. It's really important that we get those rich examples of where we're making a difference across the system, so that we can really present that back as part of the independent commission and review. Okay, thank you.
Thanks, Liz, and thanks, Denise, as well.
Thanks for listening.
And yeah, please do share that link in the chat, Liz, so that people can contribute.
Fantastic, thank you.
Well, that'd be great, thank you. I'm just really conscious of time, but I'm also conscious that I did cut Robert off a couple of minutes, probably sooner than I should have done. Robert, if you do have a slide or two that you still want to share, then please feel free. If you're happy not to, then fine, we can just include them in the digital goodie bag afterwards as well. I think before we ask Andy to close and share his reflections, we'll open up to some Q&As. I can see some comments in the chat, and I think we've responded to a couple, but if anybody does have any questions, please feel free to raise your hand. There is a question about how can we be better at joining up, from Debbie, somebody who works in public health, conscious about better joining up, wants to know any examples of much better joining up working between social care and departments. If anybody has any ideas, or if the panel has any ideas, then please feel free to drop Debbie a line, or we can discuss it here.
Shoshana, just if I can come back on that quickly, that's such an important point, Debbie, and something that certainly our adult social work group has been really keen to rectify and to try and build those partnership arrangements with public health. So we've literally just started to book in some quarterly meetings, certainly with the public health group that's looking specifically at social care, so that we can have a better understanding about our roles and our contributions there, and where we might be better aligned. So there is some kind of work happening in the background there that it's probably useful to be aware of, and we might be able to publicise a bit more about that in the coming months.
Thanks, Liz. Denise, you have your hand up as well. Did you want to come in on that?
Yeah, really, just I suppose it's just a reflection, and I will caveat this with a personal reflection, that at times there can be an element of social workers not really being given the autonomy at times and the dedicated time to get involved in some of these initiatives. And sometimes they're held at that very strategic level, who then maybe struggle themselves, senior leaders struggle themselves to have a presence within some of these forums. And so then there's just no voice in terms of social work, where actually what works really well, and you know, I have seen examples where it's worked well, is trusting your social work colleagues and actually saying to them, no, we are happy for you to represent adult social work or whichever sector by attending some of these forums, to actually give the kind of that real sense of, well, this is what we're experiencing, here's how we think things might improve, because they know the local community. So when you get down to the basics of actually what's really needed in that community in terms of preventing people from ending up in A&E, for example, because of social isolation, but actually it's presenting as an exacerbation of COPD because of anxiety, etc., etc. Those social workers will know what's available in that community to feed into some of that planning with public health. But I think at times, because of the workload pressures, which everybody experiences, they're not freed up and they're not given the opportunities to actually take part and to actively get involved. In fact, they might not even get the message that this work is even happening. So there's something there about kind of a challenge back into very senior leadership to say, we want to hear from you social workers, we want them around the table. How do we do that?
Thank you. There's a couple of questions in the chat, which might not have time to go through all of them, but I'll pick one. which came in a little bit earlier on, referencing future social work workforce. Just aware of the funding that's been withdrawn for Think Ahead to train future social workers. Do you know if there are any plans to replace this scheme, which has been really positive for their teams? And out to everybody.
So, well, I suppose the short answer, I can come in on that a little bit, is yes, sort of work is kind of beginning on that. The issue with around Think Ahead is obviously, to see anything or any initiative going is, is deeply worrying, really, because we clearly want as many routes in as possible, and so that as people will be very aware and hear a lot from government about the sort of tight financial sort of situation that we're in, and so that kind of value for money thing was clearly sort of a swaying factor in that. But I think also what we're looking at and trying to listen to also within the sector is that sort of sense of a kind of one profession kind of feel about things. Is that kind of division out, if you like, adults and children, has created some imbalances, and we see it in things like the assessed year of practice, the ASYE as it's called, that first year, and we see different funding coming through. That there's a sense that government could help to support more of a cohesive kind of professional approach, if that makes sense, to routes into the profession. So that's certainly something that we'd look at, and I guess it's in the round with lots of other things such as apprenticeships and bursaries, and looking at the whole thing together. But obviously that it's kind of difficult to get into the detail at this point, but work is kind of underway to look at that, but certainly not in terms of, it wasn't a reflection of Think Ahead itself in terms of the quality, and we recognise that that it had some real supporters, but it was it was just really unfortunate that we've been in this position, but work is ahead to look at that.
Thanks, Robert, for responding to that. I'm afraid we are out of time, so what I'm going to do with the questions that we haven't answered yet, we'll share them with the panel and we'll get back to people and share that in the digital goodie bag. I want to just give Andy the mic so that he can just share a few reflections. If you can just bear with us a couple of minutes extra, and then I can let Andy talk, and then we can close the session. So, Andy, over to you. You've got a couple of minutes.
Thanks very much. Wow. Huge thanks to our speakers, and thanks to everyone who's given your time to this conversation today, and the fact that you're putting that time into being part of the network and listening to colleagues with enormous amount of expertise. Really, really appreciate. I think one simple message here is mental health social workers and approved mental health professionals know what's going on. They work with people who are at their most difficult times in their lives. They really see the social determinants of mental health in a very acute way. So I think I'd encourage anyone who works in public health or any elected members, just go and spend time with a mental health social worker or an approved mental health professional. Don't have to have great big long meetings with them. In fact, don't pull them into meetings. Go and spend time with them. Find out what's going on for them. I think that would be enormously beneficial and interesting, and you'll learn loads, and it will really, really bring those social determinants of mental health into absolutely crystal clear view, because they really know and they experience that day to day in the work they do and the people they support. So I'd thoroughly encourage that. And just on the important question about working with communities that don't find state services helpful, working through community organisations can make a massive difference. Have a look at what's been done in Wandsworth and Bradford and a couple of other places. Again, we can share examples with you in the I love a digital goodie bag. You're going to get a digital goodie bag. What more can I say? Thanks, Shoshana.
Thank you. Yeah, we will be sending out that with the slides and everything, but I think we are going to have to wrap up. So yeah, final thank you from me as well to all our speakers for their insights today, and to everyone for attending and sparing your time as well. Sorry, we're a couple of minutes over time, but I do hope you enjoyed the rest of the day. I hope you had enjoyed coming and listening to us as well. So yeah, take care, everybody.
Thanks, everyone.
Thanks, everyone.
And to the speakers, feel free to stay